Okay, and a very good morning to you. Welcome along to our second virtual online briefing in relation to the Essex and Suffolk Elective Orthopaedic Centre. It's just after 10 o'clock on Saturday, the 15th of June. My name is Simon Morgan. I'm Associate Director of Communications for the Suffolk and North East Essex Integrated Care Board. I'm going to introduce you to our panel in just a second, but just to say, we're going to run through a few slides this morning, setting out the proposal, and in a minute you'll hear from one of our consultants. I'll describe also some details about how we've been engaging with local people across West Suffolk, and then we're going to open it up to questions as well. So if you've got any questions, please type them into the chat, post them, and then we will pick them up this end and answer those questions for you. We'll also read them out too. We are recording this event, so anybody that would like to see it at a later time can watch it back on our website. So without further ado, let me introduce you to our panel, starting with Andrew, and then I'll come on to Peter afterwards. So Andrew, first of all, please.
Yeah, thank you, Simon. So good morning, everyone. I'm Andrew Dunn. I'm a consultant orthopaedic surgeon at West Suffolk Hospital, where I've worked for 21 years, and I'm the clinical director of the Essex and Suffolk Elective Orthopaedic Centre.
Thanks, Andrew. Peter?
Good morning, my name is Peter White and I'm the West Suffolk Alliance Director, and that role involves working with communities and joining work with councils and hospitals and general practice to help bring together a partnership approach to healthcare.
Thank you ever so much indeed. Also behind the scenes, we've got Sarah and Jared who are doing all the technicalities with this briefing. So thank you very much again to them too. So without further ado, let's start by passing over to Andrew, who's going to run through the first few slides outlining the case for change. Andrew, over to you, please.
Okay, thank you, Simon. So yeah, we're going to just present a few slides about the proposal for West Suffolk patients to benefit from the state-of-the-art Essex Elective and Essex and Suffolk Elective Orthopaedic Centre. So next slide, please. So everyone will be aware, and there was an announcement in the press over the last 48 hours that waiting lists have now climbed to 7.5 million. And that was because during the pandemic, there were unprecedented levels of disruption on elective care across the country due to COVID. And as we've mentioned, the waiting list is currently standing at around 7.5 million. And this was largely because routine care was stopped during the pandemic, and reducing that backlog has been one of the government's national priorities. So an elective recovery task force was set up to tackle growing waiting lists and to ensure all capacity within hospitals was put to best use. And at national level, one of the considerations has been to establish elective surgical hubs across the country. So the government put forward £1.6 billion of funding to fund hub sites. There are currently 100 up and running across the country, and by March 2025 there will be 130, of which the Essex and Suffolk Elective Orthopaedic Centre will be one of the largest. So next slide, please, Simon. And in our locality, the picture is that our waiting lists are increasing. And if your waiting lists are increasing, then what that means is that you've not got enough capacity to treat patients on waiting lists as things currently stand. So the waiting list goes up and up. Next slide, please. And we can see that when we look at the data from the National Joint Registry, that prior to the pandemic, West Suffolk Hospital was performing around 450 hip replacements a year, around 350 knee replacements a year. But since COVID, we're not performing the same number of joint replacements that we were before the pandemic. And that's for several reasons, which I'll describe shortly. Next slide, please. So one of the reasons why we're not able to do as many hip and knee replacements is because our trauma workload has increased significantly. And if you look at data from the National Hip Fracture Database, you can see that in 2015, we were treating around 350 hip fractures. We're now treating more than 450. So there's been a 30% increase in around 7 years. And hip fracture patients are only part of the cohort of patients with fractures that we treat. So there are other injuries as well that people sustain. and that surgery on trauma patients is carried out in the same operating theatres that we use performing hip and knee replacements. So next slide, please. And because we're not able to perform procedures in NHS hospitals, more NHS patients are being treated in private hospitals, and we can see that the number of joint replacements being performed at our local private hospital, that again is significantly increased since the pandemic. Next slide, please. So the new state-of-the-art Elective Orthopaedic Centre in Colchester on the Essex site, a business case was approved in April 2022 that was, so the funding was provided by the ICB to construct an Elective Orthopaedic Centre containing 6 theatres and 2 wards or 48 beds, but 3 months later a case was approved to increase the size of the centre to provide 8 theatres and 3 wards, beg your pardon, so 72 beds, and that will enable us to perform 10,000 operations a year. So there's already good relationships between West Suffolk and ESNET, which is the combined trust of Ipswich and Colchester hospitals. And based on the capacity available to West Suffolk Hospital at the centre, it's proposed that we move approximately 60% of elective orthopaedic operations, around 1,300 to 1,500 a year, from West Suffolk Hospital in Bury Stebbins to the centre in Colchester. This would leave about 1,300 procedures that would still be performed on the West Suffolk site, including all children's orthopaedic surgery. All outpatient appointments would still continue at West Suffolk and its peripheral clinics. Patients' pre-op assessment would happen at West Suffolk, and their post-op follow-up appointments would happen at West Suffolk. They would only travel to the centre for their surgery. Next slide, please. So if you look at the work or the proposal in more detail, the large majority of work we're sending is hip and knee replacement surgery, and because the cases that we struggle with to provide capacity for patients that need an inpatient bed for an overnight stay, less or smaller percentages of upper limb, foot and ankle and shoulder procedure will be sent to the centre. Next slide, please. So as we've mentioned, there's a bit more detail about the case for change, and it's quite clear that we need to increase surgical capacity across the whole of Suffolk and North East Essex, given the predicted growth of our population and the fact that the population in Suffolk, the average age is higher than the national average. And the more elective surgical capacity we have, this will enable us to reduce excessive waiting times for our patients. So next slide, please. So the benefits of this proposal will be reduced waiting times for patients for orthopaedic operations. Surgical hubs can work in a very efficient way. The length of stay at the centre will be reduced. So 40% of patients now within Suffolk and North East Essex having hip and knee replacement surgery are only in overnight. So it's a much shorter stay in hospital. We're a major revision centre for knee surgery, so we'll be concentrating a lot of expertise at the centre. We're one of 2 hubs in the region, the Norfolk and Norwich being the other hub. And our plan is to make the centre the orthopaedic equivalent of PAP within the east of England. We've got a number of very experienced consultants that will be working at the centre within one of Europe's largest orthopaedic hospitals. And the capacity that we'll be using at the centre of the proposal supported will free up capacity on the West Suffolk site for other specialties, because orthopaedics is not the only specialty with waiting list challenges. It's really important that we're training surgeons and anaesthetists for the future, because otherwise there won't be anyone to perform orthopaedic surgery in 20, 30 years' time. And so the centre will be a high volume training facility. And as I've already mentioned, it will free up an operating theatre at West Suffolk that's currently being used by the orthopaedic team, which can now be used by other specialties to meet their waiting list challenge. Next slide, please. And this is data to show what happens when your hospital or your ICB has access to an elective hub. So the picture on the left shows the activity that you can deliver or the number of operations you can perform if your trust doesn't have access to a hub, whereas the picture on the right shows that if your trust or your ICB has access to a hub, then generally you're delivering around 20% more activity than those trusts that don't have access to a hub site. So hub sites and having access to those does reduce the waiting time for surgery. Next slide, please. So I'll hand over to Simon, who's going to talk about the approach for the public engagement exercise that we've been carrying out.
Thanks very much indeed, Andrew. Just before I continue, a reminder, please post your questions into the chat. If we don't get any questions by the time we finish the slides, then we will bring this this meeting to a close early. So please pop your questions in the chat and we will answer them at the end of this this slide presentation. So so the approach that we've taken in regard to our public engagement is that we want to hear from as many people as we can about the proposals and to understand what impact this would have on local people and to try and overcome those issues that are raised as well. We have appointed Healthwatch Suffolk. Healthwatch Suffolk are an independent charity, and they specialise in all sorts of engagement, co-production issues. So they're helping us to carry out our survey, to ask people for their views, and also, importantly, at the end of the process, to produce an independent analysis which breaks down themes and views from local people as well. And I'll come on to some of the early themes that we've had so far and the number of responses we've had to date in just a short time. It's a 6-week engagement exercise, which started on the 20th of May, runs for another couple of weeks, finishes on the 30th of June, which is a Sunday. And we've been running a number of mini exhibitions over that period. We ran one last night, very successful, at the new Bury Centre in Bury St Edmunds. We've also been out and about to places like Sudbury, Haverhill, Newmarket, Thetford, and we've got 2 more remaining now in Brandon and Mildenhall. Mildenhall is this coming Tuesday, and Brandon is a week on Tuesday. Loads of details on the website as well. We have produced a toolkit which includes some key messages, some of the artwork, social media assets, press releases, display screens for GP practices to put up on their waiting room TV monitors, etc. So we've been doing that. We've also attended some meetings that have already been set up, so locality meetings. We've had really good support from Community Action Suffolk, Sporting Memories meetings. We've been to support groups as well across West Suffolk. So we've been out and about quite heavily promoting the engagement over the last few weeks, and we will continue to do that. We've had pop-up stands in busy areas of high footfall, so places like the Hub, libraries, supermarkets, etc., telling people about the engagement, handing out paper surveys as well, and just speaking to people. We've got a really detailed equality impact analysis and also a travel assessment document which the trust has produced, and it's both are very, very detailed, good quality documents. They're available on the ICB's website for you to download and have a look at as well. We have put various editorial adverts known as advertorials in the Very Free Press series newspapers, and those newspapers included local titles within Mildenhall, Sudbury, Haverhill, Newmarket, and various other editions as well of this Express too. 2 virtual events, this being one of them. We had the previous one on the 5th of June in the evening, and we have produced a number of publicity materials as well, which explain the case of change, this being one of them. So this is a leaflet which describes the proposal in easy to understand language, and we got that available in easy read audio versions as well, and also it is available in translated versions if people wanted that upon request. We have been producing briefings for councillors, and we've also got a virtual tour as well, which Andrew's recorded with us, where we've taken our camera around the new hospital as it's being built. So all of that is on our ICB website, and we'll give you the address to that in just a moment's time. So next slide, please. So the mini exhibitions, as I mentioned, we've got now 2 remaining, because today's the 15th of June. So you can see from the 8th of June, which was last Saturday, through to Friday the 14th of June, those are all the places that we've been to. We've had tremendous response at some of those exhibitions. For instance, last week in Bury at the Apex, where we went to last Saturday morning, we had around 150 people. We had 50 people at the Sudbury Kingfisher Leisure Centre on Thursday. We had 30 people last night at the Newbury Community Centre in Bury-St-Edmunds. So some really good outreach engagement work that we've been doing, and we've had some really good feedback as well from local people. A mixture of responses, and I'll come on to that in just a second. So next slide, please. So here are the early themes, and you'll be really pleased to know that we've had this is correct as of Thursday. So we've had 1,224 responses to the engagement since it started on the 20th of May. And within that, a number of different comments, both positive and of concern. And I'm just going to pull out 2 from each area. So the 2 positive comments are that many people welcome the idea of shorter waiting times, especially for those people who are living in pain, discomfort, and are finding day-to-day life quite challenging because of the level of pain that they're in. So many people have told us that they would really welcome a reduction in waiting times, and that this new centre would bring them if it did go ahead. There's also the risk, the reduced risk, I should say, of cancellation of appointments as well that this new centre would bring. So they were quite positive in those 2 areas. There were 2 areas of concern as well, which I just wanted to share with you this morning. One was around getting to and from the new centre in Colchester, especially for people who live out in rural areas, rural communities, and some of those towns in the north of West Suffolk as well, so like Mildenhall, Brandon, etc. We've been hearing quite a bit of feedback around that. And some people have also said that going to this new centre might mean for some that they would be further away from their loved ones, from their family, friends, support networks as well. So 2 areas of positive feedback, 2 areas of concern that we've had so far. There are many other areas of positivity and areas of concern that we've had, but I think those overall 4 comments have been most prominent in our engagement to date. Next slide, please. So we are running the engagement until the 30th of June. We've taken quite a bit of time to design the engagement approach, and we've had some very good support from our partners and councillors at the Health and Overview Scrutiny Committee, known as HOSC. So they've been involved at regular intervals. We have been in touch with them. We've attended their previous meeting back in April, and we're due to present back on the 17th of July some more feedback, and just to give them an update on how the engagement has gone. And by that stage it would have closed as well. Once we've been to HOSC, we will then present the report to the ICB board, who will make the ultimate decision, of course, about the proposal. They will receive the report, will comment on it, will probably note it, and then they will make the final decision thereafter. And then the new centre will open later on this year, late October, early November time is the timescale that we're working to at the moment. So we're looking forward to that opening around that time. Next slide, please. And there's confirmation then of our website as well. So Suffolk and North East Essex.icb.nhs.uk/elective. There's lots of information on that website, including these virtual briefings, recordings of these virtual briefings, leaflets, translated materials. There's also an audio version of the leaflet as well, and also a link to the survey, which of course is on the Healthwatch Suffolk website. Also details of our mini exhibitions and our 2 remaining ones, which are taking place this coming Tuesday at the St John's Centre in Mildenhall, and the following Tuesday, the 25th, at the Brandon Leisure Centre in Brandon between 2 and 4. So that is it of our presentation. Peter, is there anything at all you wanted to add before we move on to questions?
No, thank you, Simon. I think it's been very comprehensive. Thank you.
Thank you ever so much. Andrew, is there anything else you wanted to add before we move to questions at all?
No, nothing. Thanks, Simon.
Okay, lovely, thank you. And let's go to questions. I can see that we've actually had no questions received in the chat, so in which case I will bring this now to a close. So just wanted to say thank you very much indeed for joining this session today. I hope you found it useful. Recordings are available, so you can watch it back at any time that suits you. Thank you to everyone on the call today, to our panel, Andrew and Peter, and also to Sarah and Jared for the technical support they've been providing today as well. Thank you very much. Please do come along to one of our exhibitions, and we look forward to hearing from you via our survey in due course. Have a good rest of the day. Bye for now.